Prevention efforts focusing on increased contact, tracing, screening, and testing as part of initiative to continue the spread of the Marburg virus. Details in the report.
On the 27th September, the Rwandan government confirmed the outbreak of the Marburg virus in at least 2 major hospitals in Kigali. Since then, health agencies in the country have put in place several strict measures to contain the spread of the virus. This has helped prevent a sharp increase in the number of deaths caused by the disease, despite the rapid increase in infections. At the press briefing in Kigali, Rwanda's Health Minister Sabin Nsanzimana said 61 people had contracted Marburg by Sunday, 13th of October, since the first cases in the latest outbreak were reported 2 weeks ago. So far, 14 people have died of the viral infection, 18 have recovered, and 29 are still receiving treatment. Some of them are said to be in critical condition. The Rwandan government is upbeat that its health intervention measures are working.
The past 7 days, we've seen more recoveries than deaths, which is a good indication that the response and the treatment is actually making some good hope of the end. Secondly, we have recorded 3 days in the last 7 days. In those 3 days, we tested samples and we had 0 cases. So it's also unique for this week, but doesn't mean the testing and new cases have already ended. It means that at least the risks of transmissions is being contained.
Health authorities are focusing on more than 400 people who came into contact with the infected. They are being kept in isolation to avoid them from spreading the disease. Rwanda launched the vaccination drive earlier with help from the World Health Organization.
The other highlight of the week is that vaccinations have continued. We've reached more than 600 vaccinations so far. Of the 700 doses we received, at least more than 600 have been already utilized. But yesterday we received more doses, last night, about 1,000, which means we are going to continue to protect the most at risk, particularly the healthcare workers.
Since the outbreak was reported, Rwandan authorities have suspended hospital visits and limited contact with suspected cases. Works and home vigils for Marburg-related deaths are prohibited to prevent gatherings that could spread the virus. Only a maximum of 50 people can attend such funerals. The World Health Organization says countries do not need to put in place restrictions to travel to and from Rwanda, as the disease is currently under control.
Travel and trade restrictions actually can act as a disincentive, not only for Rwanda but for other countries to share information. Rwanda shared their information on the outbreak early. They have been working on the outbreak. They've been working with WHO and partners. So it's important not to have restrictions, because that can then have a counter, it can actually harm the outbreak responses.
The World Health Organization has sent experts to train Rwandan healthcare workers and provided essential medical supplies to combat the Marburg outbreak. Health authorities report that over 80% of the confirmed cases involve healthcare workers, with majority of deaths also being